thus their emotion. Many men feel uncomfortable discussing their emotion or expresses with mental health, they deal with it internally, or they opt to use substances as self-medicating. The perceived inaccessibility of help. They always say, no, there's nothing can be done. Some men believe that mental health services is primarily for women, and they believe that resources are not for them. Whatever available is there that I have talked about. And we look at the socio-economic factors. Some men prioritize work and financial stability over their mental health. Work, even in a tired, work, you look at men, they go and you look them walking distances to provide for their family. They have not eaten anything. But then you hear this man say, and I gave my girlfriend to keep this money, but when I ask her, where is that 1,000 I gave to you? I spent it in my Brazilian because you did not buy it for me. So I also had one of my clients who was a director, and the husband was a clerk, but they are not working in the same town. This wife came crying. I'm stressed, doctor, I'm having depression. I said, what is the problem? Sit, my girl. It's my husband. Doctor, let me ask you the question. When you say a man is a head of the house, and when you are married, is the man not supposed to take care of the wife? I say, it depends. Let me hear your story. They say, no. I ask, where are you working? Where? What is your position? I'm a manager there. And what is your husband doing? He's a clerk at so. And when you have got your income, who get more? It's me. Now what do you want? No, I want my husband to take me to the salon and pay for it. I want my husband to take me to the shopping. I want my husband, when he's going to the town where he's working, at least he leave me with a full tank. Hey, I remember my only son. I say, is this what my son going to go through? Over my dead body, it's not going to happen. If I hey. Then I went into financial planning with this lady. This is what you need to do. This is what your husband, do you know that your husband has sleepless night? Do you know that your husband is struggling with mental health issue? Because he want to please you, but he left with nothing. So get your things correct. Then when you plan, you can go to your hair salon and spend. When you plan, you go to Groove Mall, you come with bags here and here, you did your shopping. This is what we liberate ourselves as women. I only tell my husband that I'm going to the north, but I don't expect him to fuel my car. I will tell my husband that I'm going to Groove Mall. Let me share you one of the secrets. Because I have all these kids that I have talked about that they have been to university, none of them had a scholarship. The reason, your mother is a doctor, your father was once a CEO. So now at the end, whatever I'm doing, I'm just paying school fees. So I become stressed over it, the financial. I went to, what is this one? Marua Mall. I bought 11 pairs of shoes. When I came home, I don't know if I love them all. You see, those are the things. So, men need to take care of their mental health. They also have got fear of losing a job or income. Let me tell you the secret. When people are coming to seek mental health services when they have problems, they will start with a social worker, they go to the psychologist, then it's only, Dr. Njaba will only be the last sort because she's a psychiatrist and I'm not crazy. I don't treat people who are crazy. I treat people with mental disorders or mental condition. And the stress alone, it is already called mental illness. The World Health Organization have stated that among 8 people, the 4th person is mentally sick. Let me start from myself to the chairperson number 2, number 3. Madam, can you deny or acknowledge that you have experienced mental health issue. You are not in a spotlight. It's just a share. I can help you. The mere fact you have gone home. Which language do you speak? English, Afrikaans. I'll put it in Afrikaans. Ek is moeg. Then in English, I'm just stressed. Stress, moeg. Those are mental health conditions. Why didn't you come to Dr. Njaba? It's just because you are experiencing it mild. And when they become severe, moderate to severe to profound, you cannot come to work anymore. The people you work with, they will look at your office face. How is she today? Can I go and talk to her today? She looked okay. Why do we have to have moon faces and understanding is only when I can talk to this person? And it's true. All of us here, we have undergone that unconsciously or unconsciously. So addressing the issue is for seeking help for your mental well-being. What are those factors that contribute to women seeking mental health services than men? Women are sociable. They communicate. Although when they talk and communicate, Papa, you like talking. Women are more social beings and more open about their emotion and expresses them. They seek support from others. Great awareness of mental health. Women tend to have better understanding of mental health issues and the importance of seeking help. How do women cope? Because they are even more exposed to mental health issues. They tend to use different coping methods, seeking social support. Women have got a women group, they go to church, they do all those kind of things. The experience of mental health issue, women have experienced different pattern of mental health issue. That's why they seek help. They also have support network, as I have talked about, having strong social support from their friends, their family, and they are more connected. And this connectedness make them safe. How do we reduce this stigma now? There has been a growing acceptance of women mental health issues in the society. She's like that, she's a woman, it's okay. But that have reduced the stigma. This shift has led to reduced stigma surrounding women seeking for help and their well-being. Then there is empowerment and advocacy for women. There is increasing focusing on women empowerment and mental health advocacy has helped them to recognize their rights and to seek support and prioritize their mental health. What are the strategies that is there to improve our mental health and gender? Awareness and education, raising awareness about the importance of equality and its impact on mental health is crucial. Policy changes, implementation of policies that promote gender equality and protect against gender-based violence can improve mental health outcome. Access to care, ensuring equitable access to mental health services for all genders is vital for addressing the disparities. Support system, creating a supportive environment such as community program and the workshop initiative can promote mental health. In conclusions, addressing gender inequality and the mental health together is essential for creating healthier societies. Need to focus on both issues. We can work towards improving mental health outcome and achieving great equality for all individuals. I thank you.
I think today, let's respect that element. For us to have all the activities that were planned for today to come to conclusion. We have 3, but if we will disregard the time, then we might not finish them today. That is why I am appealing to all the honorables, please, let's stick to the presentation of Dr. Njamba. We focus only on the presentations. Our questions, our comments should be aligned to the presentations, not other issues. Honorable members, it is now time for questions or to make comments on the presentation. Yes, Honorable.
To ask for to marry the wife. Now, what he think about and what he decide is, me ask you to marry. Don't come and tell me what to do. I am the man. It's like the men own. It's like it's a property. You are my property because I go and take you from your mother's house. It's such a issue that we undergo in our society. And the other case was if the two people decide they want to marry, from our tradition, first thing to do is both must go to their parents or to their elders so that they can have the background from their parents, how to behave and how to go in and to behave you in your marriage. And afterwards, you come and say, Pastor, I want to marry. Now, sometimes it happens that one come without any knowledge of how to behave in the marriage, and the other one is full of the knowledge. So it happens that one half is empty and the other one is full of the knowledge. This how the conflict is start in the marriages. This is this is the issues I have from the pastoral care as the marriage officer. So I submit. Thank you.
Let me just announce again. I think it's just a reminder. This is for record purposes. When we are giving our comments, our questions, please mention name and region or constituency. This is very important because it is being recorded. Thank you. I saw a hand here. Yes, Honorable.
Thank you, Honorable Chairperson, honorable members. I'm Gina Clements from Commerce Region, Windhoek Rural Constituency. And thank you, Dr. Njamba, for the wonderful presentation. I rise to just make a comment on the presentation by Doctor with regard to awareness. Yes, well, we acknowledge that awareness is happening, but the question is it aggressive enough? I would like to always refer to the awareness campaign of my time, and that was the awareness on explosive devices, sorry. So, and I am sure all of us here can relate. The awareness campaign that was on don't touch it, report it. So maybe we need uh, an aggressive campaign on mental health so that we are sure. Let not take it as if it's done properly. So let's continue. Let be the awareness. Let it be aggressive enough, and let's use all different platforms, especially rural communities. We heavily depend on various platforms, but our radios is the most uh, media instruments that we rely on. I so submit. Thank you.
Thank you, Honorable Chairperson, honorable members, Dr. Jamba. Good morning. My name is Naomi Mzala. I am from the Zambezi region. I have two questions. I appreciated your presentation, especially at the point where you mentioned that we should move away from awareness to action. As someone who is in the space of advocating for mental health in my region through a women empowerment initiative known as Women Unleashed, I would like to find out, over the past 5 years, we have engaged with the Ministry of Health as well as the Ministry of Gender to raise awareness on the urban women in urban areas as well as women in rural areas. But my question to you was, is there more that we can do to make sure that we can say we are progressing from what we are already doing in terms of the advocacy and information sharing? And the second one was, how do we bring men on the table to have conversations with us in terms of mental health? Because for the past years, like I mentioned, there is poor representation of men in our seminars. Those are the two questions. Thank you.
Thank you, Honorable Chairperson, honorable members. I am Saima David from Ngodi constituency, Oshkoto region. I have three questions. My first question is, when will we see a clear action plan integrating gender equality lessons in schools within the rural constituencies? Sorry. The second question is, what concrete steps should be taken to involve men in household level responsibilities to reduce women's mental strain? And the third one is, beyond policies, what accountability mechanisms are in place to ensure that cases of gender-based violence in rural areas are acted on quickly and fairly? I so submit. Thank you.
For another chance, let's acknowledge first the presence of the teachers and learners. They are from pre to grade 7, and they are learners from junior private school. So teachers, learners, I would like to welcome you to this house. Feel welcome. Thank you. We can proceed. One more. Yes.
Thank you, Honorable Chairperson and honorable members. My name is Maria Garizis. I'm from Almighty region. Mine is just a comment on the issue of cultural norms. When it comes to men and women, in the way of the culture, they believe that a man cannot cry out, which is a very, very unhealthy way. They said women must cry out and cry loudly for her health. And when it comes to the men, they said men must cry but not loudly, and it's unhealthy to them. It's whereby we see it's a dangerous sign in emotional. If you not talk out or speak out, it's unhealthy for your body and even for your mind. And if we continue, I think that the cultural ways or norms are very even dangerous too when we come to gender issues. I shall submit.
Dr. Njamba, the floor is yours to respond to the questions.
Thank you, Honorable. I will try my best to tackle questions as they put forward. Some I have an answer to them, some I have no answer to them, but it's for us to deliberate, to discuss about it. And the teachers and students, you are welcome. I wish you were here when I was presenting so that you start learning. And because also one thing that was talked about is are we including mental health in our schools? It's just the same as we are talking about. Do we want to talk about sexual issues in our schools? That is something to be debated about. Honorable Pastor, marriages and our cultural norms, men are the one that ask hand in marriage. That is based in our culture. But nowadays, I think because our children are copycat, they are no longer following that culture. That's why some of us parents, you might just see your daughter saying, "Mommy, I get engaged." How? Was that person even introduced? That's why marriages now are no longer lasting. And that engagement was more based on economic, because this person have something, was able to offer something, and then now when this person has nothing to offer, then you will hear that, "I cannot struggle, I cannot suffer, I have called it a day." Marriages nowadays is just to be called it a day. But we are also encouraging that where there's gender-based violence, that I think and I support that. Now I was watching Tupopieni last night, which there was also a pastor there who supported I know our Roman Catholic does not support that one, but I think those are another level where now I think with gender and whatever happening, that at your own platform you need to discuss about it. Behavior, of course, we are talking about counseling. Even one of the divorcee who was talking about yesterday was talking about counseling before marriage. Is it enough? Is it twice or 6 months, or how long should it be? But also that is just somebody hiding behind the facts, because the pastor, when he's doing the counseling, is not the one who identify the love between the two. They are just trying to encourage you to say, in marriage, this is what is expected of you. And the marriages and the cultural should also be together. But now what happened is that the people are taking things literally. To say, I'm the one who came and proposed, I took you from your parents, I've got the right again to take you back to your parents. But they forgot the day of their marriage. There is a vow that they have taken, until death do us part. It did not say when we are no longer understanding each other, we must then take this person back to their parents. But there we do acknowledge. I say, if in the marriage there is a violence, then that marriage should not continue. Should also not stick to until death do us part. Our parents have suffered in their marriages. I'm just here because of the sake of the children. And even currently, it's also still happening. People are suffering in their marriages, but they stay together because of the sake of the children. And what the society will say, and what also the church will say. So all those issues, we have to be together, whether we as mental health care providers and the community. If the church is having some seminars, they must invite also the mental health care providers, so that we share, we also listen to you, so that because we also come into contact with the community, how do we address the issue? And you also come into contact with this community that has got mental problem, how do you address them and when to refer? We are not saying completely that when I was talking about traditional healer and the spiritual, we are talking about these churches have made it very clear to say it is your neighbor. I don't know where in the theology that a pastor learned to understand that the neighbor is the one reaching the other one. So I think I have done justice to your concern. The second one is somebody say yes, awareness has been raised, but is it aggressive enough? And information was given, like when they were clearing the exclusive those things. What happened is that, as I say, also I have been to radios, I have been to television. What happened is that recently I went to Zimbabwe. Our mental health here is not scaled until to the community level when it comes to service provider, apart from awareness. So when we went to Zimbabwe, is that we have, Zimbabwe has got 2 standing mental hospital on their own. But remember I mentioned that we only have Windhoek Central Psychiatric Hospital, which is part of Windhoek Central, and we have Ward 16 at Oshakati. And then now, because of that, how do we divide the service? We have got 14 regions. So Windhoek is receiving patients from 9 regions. They are being couriered to Windhoek. Then Oshakati is receiving patients from 5 regions. Kunene and the 4 O's. And the Windhoek cater for the rest. So, and even the space alone is not enough. And why? We also have got stigma. And currently, we have got only 3 psychiatrists running the Windhoek Central Hospital mental health services, including forensic services. And of those 3, only one that is a Namibian young, the other one is an expatriate on contract. I'm currently there because when I went on the retirement, I'm on contract ending 2027. And when you have your daughters who are at medical school, either Namibia or elsewhere, they don't want to specialize in mental health, because the question is, even myself, when I went to specialize, my husband was facing that stigma. The question was, what did you do to her? Why mental health and not gynecology or pediatric? But then I look at the availability of the professionals. They are not in the country. And even when the services come, you see mental health does not choose. Any one of us can suffer from a mental illness. So there was even a style where they identify a doctor with mental illness, will be sent to come and become a doctor at psychiatric hospital. I stood my ground. I say no. The nurse is the same thing. We have also the security from NCS, Namibia Correction Service. They are guarding the forensic. Those who are mentally sick, they are the one also being sent. I say no. We need to have people with sound minds to do those, because how can you be stressed and the stress is put upon you? A mental illness can tell you, fuck you, mad, or sorry, they are kids. But we don't have grudges against them because we know that they are mentally sick. So the aggressive campaign, when we visited Zimbabwe, we have copied their module, and we want to shamelessly copy it and paste it in our Namibian society. As I said, they have got 2 standing mental hospitals with 10 provinces, and 4 of the provinces has also mental health units. And they scale down their mental services to each and every hospital, clinic, health center, and even into the community. They have got people they call grandmother friendship bench. This grandmother friendship bench, they're into the community. And these people, if you become stressed at night, you know the grandmother friendship bench member is just next door to your house. Then immediately you go to the person, you explain, they are trained, they can educate, they can refer. And that is what the action I was talking about, that we are now trying to as soon as possible to take that action to make sure that mental health services is up to the grassroots level into our community. We don't know whether we are going to call them grandmother French bench, because these are people who perhaps was a doctor, was a nurse, and is in the community. They have nothing to do. They have got all the knowledge and skill. They just told because you are 60, go home, but they still have the knowledge. Of course, the radio and everything will continue. We will identify those members in your constituency. Then the other one is that is there things that are done? What is this question? Is there more? What was the third? In the society, and how are we going to bring our men to this mental health and whatnot? As I said, that if then we come up with this program that we are thinking about, that mental health services is up to the community. Education, we need to educate our men. And even when you are here today, I'm sure you are representing them. You go and tell them that their economic, their work, their financial, their norms, their masculinity, their cultural beliefs, it should not prevent them from seeking help. Those things that they receive from their peers, self-medicating when they go and they use substances, they should feel welcomed. They should feel isolated. They should not feel isolated. That is only when we are going to break the stigma. The problem we have is stigma, and we need to break the stigma. Clear action plan in school concerning gender, and also involvement of men in the household. Then the mechanism to reduce the gender disparity. That, I think, was the fourth question. These are issues like now I say we have a bill that is going to be presented. Some of those are the question was asked, do we have a program for mental health in schools? We have school mental health program, as we are saying that we have got few of the healthcare providers, and sometimes also we need to involve the parents. Are the parents comfortable, feel comfortable for their kids that a nurse is coming from Okuyongava Clinic going to a certain school and talked about mental health? I remember one of the medical students was doing research among the kids, and they have to ask permission from the parents. The parents refuse. Why? It is just stigma that is attached to it. And even when you talk about suicide, it's like you don't speak about it because you are motivating somebody to then to understand how it's done, whatever. It's like you are encouraging people to do so. But I think it's high time. I support it that it should be, but that it is, should be a stakeholders' decision. Minister of Health, Minister of Gender must be involved to take that decision. Again, the last, cultural norms. Men and the women believe that men should not cry. If they have to cry, a little bit of it, and the women must cry loudly. This was not a question, it was more a comment, a concern about our cultural norms. I want to agree with you that we have to do away with this. You cannot imagine your wife have died. This is a wife you have been together for the past 50 years. And you might have only stayed with your parents when you were 25, when you get married. When you compare, you have stayed longer with your wife. Why can't you cry when your wife has passed away? Even more loudly than anybody else. And it will be the talk of the nation. So was as if, though Shwamba speaking, on Katarume. No, express your emotion. This is a person who knows you more better than your own mother, your own sister. When you turn adolescent and you become a mature man, have your mother saw you naked? No, it was your wife. Who knows you more better? It is your husband. It is your wife. And if one of them passed on, why can't you cry more louder than even a woman? Thank you.
We can see that we have exceeded the time. We were supposed to break for tea, 10:30, but we have just to bear in mind that we are with a person who has got other responsibilities. We have to finish our questions or our comments so that we can allow the doctor to go and attend to other responsibilities. Now I'm going for the second round. Yes, come, Honorable.
I just wanted to ask, is there a toll-free number that is 24/7 available for somebody to call in at least to start getting counseling on the phone? That's all. I submit.
Honorable Chairperson, honorable members. My name is Mdimbanjo Shumanda. I'm from Oshkunde constituency, Ohangwena region. I raise to comment or participate in the topic of gender equality and the mental health. I would like to appreciate or thank Dr. Njaba on the very inspiring speech on mental health. However, I would also like to bring it to the table that she talked about the awareness. Of course, we agree, we did a lot, but still, looking at our people living in the rural areas there, a husband and a wife, where there is no a network coverage where you will get information, there is no TV, and then there's no rehabilitation centers, no hospital, no police stations. So it becomes a very big challenge or a burden to these people to access to this information or get in a streamlined to get help at the early stage of mental health problem. So my question is now, let's say a person is living in areas like, she mentioned that she's from Ohangwena. We have people living in Ompoto there, in a remote area. There's no nurse, no police stations, and these people, they don't have means to travel to hospital, nearby hospital or nearby police station where they should travel almost 100 kilos. As a profession in these fields, what interventions are you putting in place at least to help these people to get access to this information? I so submit. Thank you.
Honorable Chairperson, honorable members, I want to raise few issues. When it comes to the high rate of suicide.
Honorable Kapenda, sorry to interrupt you. For record purpose, your name, your region or constituency.
Okay, thank you. My apology. My name is Absalom Kapenda from Oshana region, Kaku constituency. And I want to raise my concern when it comes to higher rate of suicide, especially in men. I want to propose something or some points which need to be put into consideration, like to develop a national gender-sensitive suicide prevention strategy with targets for reducing male suicide. Another one, to fund pilot male-friendly mental health services in at least three at least 3 regions, or 1 urban or 2 rural. And also to train teachers or church leaders and community health workers in mental health, literacy, and referral. Also to launch a media campaign that normalizes men seeking help and provides helpline or contact points. And lastly, to strengthen routine data collection and publish annual gender disaggregated mental health reports. I so submit. Thank you.
Dr. Jamba, the floor is yours to respond to the questions.
Thank you, Honorable. Thank you, members. If the process is delayed, it becomes a problem. I think that one I have already alluded to. That's why I'm saying it's better for us to seek help. But where? Where do we go? And the question was, do we have toll-free numbers where a person can reach out? That's why I said that the model that we copy from Zim, where we want to scale mental health into the community, it will be workable, because then you will be able to identify who are those people that you can reach to them easily. Of course, currently we have got Child Life and Lifeline. Unfortunately, I did not come with a number, but if you Google, you'll be able to get the number. It is available 24 hours, and I will want to consider the concern also from the member from Oshikunde, that there are areas which are not network reachable. And also I take recognition of our economy, poverty. Even if this person has got a problem, will this person have a credit to call that line and to get help? Because it does not mean that if it's free, if there is a zero credit, you'll be able to reach them. So those are things that Child Lifeline and Lifeline that is available currently. And of course, we have got few facilities within our constituencies, within our society. You can go there and seek help, then you can be referred. But don't have a stigma when somebody say, okay, I've heard your story, I'm going to refer you to mental hospital. Then you say, I'm not crazy. We don't deal with craziness, we deal with people with mental health issues. Of course, the counselor, the Honorable from Oshikunde, people in rural areas, no network, no hospital, no clinic, no radio, no television, difficult for the members of the society to get help. No nurses, no police stations. This one I want to send the message to the councillor for Oshikunde. When we come and debate, when we were voted, we need to identify our problems in our constituency, and we need to demand more. I know we have a habit of there's no money, but budget, and they say this is the problem we have in our constituency. This constituency of us is too big not to have a police station. It's too big not to have a clinic. And of course, when he's talking about that area, if you don't have a 4x4, you can't reach anywhere. I know where I'm coming from. So now, the road network, what are we doing? This, we leave it to our politicians, and we are supporting them. we will bring our problem, but my practice of the past years, if the politician does not approve, nothing will move. So therefore, we need to put more pressure on them to deliver, and we will be there to break them. The Okaku constituency, increased suicide rate in men. He wished to propose, that's a good thing, that's why we're here. We cannot kill this gentle giant alone from the health perspective. We as community member and every person, we need to be involved. In fact, they are already, I think there was it in Utapi or something, men mental health awareness. And even Vinduk here there was. So what you need to do is to plan and invite. You only need to come up with a topic that many mental health or suicide prevention, but you will not be the person to talk about it. You invite the professional to come and talk. So if there is no initiative from the community, then nothing can be done. Because if we scale from the head office to come, then you may not be welcome. But if it's an initiative from the community that there is this need and we need your help, we are always willing to come and make sure that we assist by developing that gender relationship for prevention of suicide. And we can also train the leaders, communities, church members in mental health. And also to provide, after that, when there are people who are trained, then we can identify the contact number. And sometimes you don't need a contact number. As I told you, the model from Zim, that you have a friendship man in that society. But you must also remember, when you are given that responsibility, who are you, this man? If you are the one who spend your whole day at the cooker shop and even drunk, the person will have resentment to come and seek help from you, because they know the day after tomorrow they will say, Thomas was here telling me that the wife what, or the what. So we need to make sure that, as I were saying, the model of Zimbabwe was very friendly, because these are professional. The teachers, when you retire, what are you doing? The nurses, when you retire, what are you doing in the society? The police officer, they know, they read the law, they know, what are you doing? But we just become commoners and we are the one doing all this, sometimes also committing some suicide, gender-based violence and all those kind of things. Thank you, Mr. Smith.
Time to make a presentation on the important topic. Thank you for the presentation. It is well received by the honorables, members of the Rural Women Parliament with men as partners. Thank you very much.
Can I share something? Honorable, can I share something? Please, it's a plea, go and become ambassadors. As much as we think that our men are difficult, they just need to be educated. They just need to be made that you should not base your decision on the cultural norms and the societal belief. See yourself as an individual who need help. We have rescued a lot of people who need help. Sometimes we rescue them through, they will have a child, because when there is a problem at home, it also affects children. And the children are easily to be brought to us. Then when you go into the discussion with a child, then you pick up that there is a problem between the parents. And then now when you invite them to say, I want to talk about the issue with your child. Then in between, you have an opportunity to speak to that. I recently have an example of one person, the child, then the lady, the wife came, the husband was hesitant, but after I spoke to him and I travel, he's the one now knocking on my door. When is our appointment? I think now it become even urgent, which has not been urgent all those years. So therefore, in this, we are also talking about the rehabilitation centers. Unfortunately, we have only one rehabilitation center, which is at Tegameno for the states. And there is a increase in substance use. The alcohol that is legal is a legal substance. We call them substances, whether it's alcohol. Then we have got the cannabis, the marijuana, the weed, the vape, the herbally. What are our children doing? How are we approaching this now to educate our children? We cannot reach out because we are very few. We are trying by all means to make sure that the ministry sensitize and send more people to specialize in mental health so as to assist our kids. When I went on retirement halfway before I then recall back, I opened up a private mental health hospital which was based in Windhoek, which was used to call Barre Street. You know, there is no area where there is no politics. Politics came in, the hospital closed down. I moved on, and currently I'm running in a consultation room which is private, and also a private admission called City Hope Wellness. And my consultation is Holding Hope Mental Health Practice. Why did I mention it, Holding Hope? I want to hold on and inspire hope to the hopeless. So please, if there is anything, my number can be shared. Feel free to contact me, and I will be available for your service. Thank you.
We will still continue with the debate on the topic of gender equality and mental health. We are now breaking for tea, so please let's come back at 11:30. Let's be in the house by 11:30. Thank you, Honorables.
a contribution on a motion, gender equality and mental health awareness of the 8th Rural Women Parliament with men as partners. Gender equality refers to the state where individuals of all genders have the same rights, responsibilities, and opportunities in society, leading to the equitable and respectful advancement of all people, rather than they are becoming the same. Equality on human rights and all basic needs. We cannot force to be the same. Enhancing gender equality and mental health awareness among women requires a carefully planned strategies to improve access to information that empowers women. There are several interconnected barriers that prevent gender equality and mental health. Like number one, male dominance. Where there is a social system upheld by cultural values that position men as the primary authority figures in households and communities. This resulting in men making all important decisions, controlling resources, and limiting women's autonomy. Men are highly valued. That makes it that in some society, women sit on the ground so men can take chairs. Men must eat first. When they are satisfied, it's only when women can eat. Or a married woman cannot eat when the husband didn't eat, as she have to wait and starve until the husband finishes eating. Number two is male entitlement. Cultural norms in patriarchal system can foster a sense of entitlement and authority among men, leading to coercive control and violence towards women. This entitlement makes some men think they own women. So a woman do whatever the man says and she have no right to say no. He decides on what should a woman do or not do, what kind of clothes should a woman wear. That should be decided by a man. This is a reality, especially in rural women. Number three is a traditional gender role and stereotypes. This refers to the long-established societal expectations and beliefs about how individuals should behave based on their perceived or assigned gender. These are some traditional gender roles and that prevents equality. So men are expected to be the provider or the breadwinner, to be strong, assertive, and emotionally reserved, leaders in public life, for example, politics, business, and even traditional, protector of the family, while women are expected to be caregivers, homemakers, and nurturers. Women are expected to be gentle, passive, and emotionally expressive. Women are expected to be the support of male leadership. So women are also expected to focus on appearance and domestic duties. For examples of gender stereotypes are like what Honorable Dr. Njaba said, like boys don't cry, like girls are bad at math, I mean mathematics. Men are naturally better leaders, or women are too emotionally to make serious decisions. Men should fix things while women cook and clean. So the other barrier is economic inequality. These are the gender pay gap, limited resources and occupational segregation creates financial strength and dependency, especially for women. They also contribute to higher rates of depression and anxiety among women that are facing economic insecurity. So the other barrier is lack of legal policy support. Inadequate or unenforced legislation for equal pay, property rights, and protection against discrimination and harassment perpetuates inequality, gender-based violence, and discrimination. Higher rates of domestic violence, sexual assault, and harassment in homes, workplaces, and communities have devastating impact on mental and physical health of women and marginalized genders. Women in rural areas suffer physical abuse in the hands of men, but traditionally, they knew it as normal. When you complain to the elders that, for example, maybe your husband is abusing you, is beating you, they'll tell you it's normal for couples to fight. Even if a lady attempts to report it to the police, then you must be prepared to a war with your in-laws, including the society. The other barrier is early marriage, especially in girls. It's a formal and informal union of a girl child who is under the age of 18. So, because of poverty, some girls engage themselves in transactional sex to get things like food, toiletries, clothes, and many other necessities. In the process, young girls fall pregnant or get infected with diseases. This results into barriers to schooling. The girl child will drop out of school to take care of the baby. Loss of future opportunities, health risks to maternal mortality, because the girl child is not yet ready, the body is not yet ready to give birth. Violation of human rights, early child marriage is a violation of multiple human rights that include the right to education, the right to freedom from violence, the right to health, and the right to choose a spouse. Traditional gender roles and stereotypes are powerful cultural forces. However, they are not fixed. By challenging them, individuals and societies can move towards greater equality, authenticity, and inclusivity. Barriers that hinders mental health awareness and care. Number one is stigma and shame. Negative societal perception of mental illness creates a powerful deterrent for seeking help. Many people fear judgment, isolation, or professional percussion in their struggles are revealed, leading them to suffer in silence. For example, the current suicide rate escalating is the result of deaths. People are afraid to accept that they are in debt and they cannot cope. So they suffer in silence, they commit suicide. Lack of awareness and education. Low mental health literacy means many people struggle to recognize symptoms in themselves and others. This can be due to inadequate educational resources, cultural gaps, and the normalization of mental health struggles. Number three is cultural and religious beliefs. Sometimes cultural norms promote emotional restraints, and many perceive mental health issues as a sign of weakness or a result of spiritual causes. This can discourage help seeking, especially if it conflicts with religious teaching or family values. Limited access to resources. Short of mental health professionals, financial barriers like high costs or inadequate insurance coverage, and geographical isolation, particularly in rural areas, make it difficult to access timely and effective care. This also means people are not aware that these types of service do exist. Inequality fuels mental health issues. The chronic stress from gender inequality, including economic hardship, violence, rape, and discriminatory experience, is a significant risk factor for mental health problems like anxiety and suicidal acts. In conclusion, Honorable Chairperson, honorable members, there is an intertwined connection between inequality and mental health. Gender inequality is the mother of mental health issues, such as emotional, psychological, behavior problems. Once a person is frustrated, he or she may end up into alcohol and substance abuse, anger, violence, and change in behavior. People, we are sick in mind. That's why we see strange things in our society, such as murder, rape, suicide, and violence towards each other, including innocent little children. Therefore, the government should initiate awareness, especially in rural communities, to let people be aware of their emotions and encourage them to seek help instead of keeping it to themselves and vent into anger, violence that always end into suicide and murder. And so I submit. Thank you.
Thank you, Honorable. Now let me finish the Honorable behind, and then we start with the first row this side.
Thank you, Honorable Member. Honorable Chairperson, Honorable Member, my name is Dorota Shikesho from Oshana Region, Omunja constituency. My concerns are as follows. It is a great of honor for me to attend this 8th Rural Women Parliamental with men as partner on gender-based and mental health. Namibian National, day and night we are here bad news. People abuse each other because of alcohol and some of mental health. We must support and take care of women and men equally. Parents in different communities, please take care of your family and your neighbors. If somebody needs something to eat or water, please share. Many people are dying of suicide because they are afraid to speak out their problem. We need counseling in clinics, in school, and awareness in our local languages. Some people know it is okay to ask help. Equality means respect and dignity for everyone. Economical issue and mental health among men. Explore link between losing jobs and suicide behavior. Some people, if a man lost job, stress will become too much. Parents must collect their teenage because they abuse themselves because of money. They drop out school to search some stuff. Help each other in order to become better, to become a better person and have a better future. I thank you. I so submit.
Thank you, Honorable Chair. Chairperson, honorable members, I, Gelasius Muhembo, from Kavango East Region, particularly to single out from the Yona constituency. It is my privilege and profound honor to stand and raise my contribution on the motion Gender Equality and Mental Health Awareness for Rural Women Parliament with men as partners. Honorable members, I raise today to move that this August House deliberate and resolve on urgent measures to strengthen gender equality and to promote mental health awareness in Namibia, with a special focus on the Kavango East region. Namibia has made a commendable progress in gender equality according to the Inter-Parliamentary Union 2023. Women hold 24% of seats in parliament, one of the highest rates in Africa. Our constitution, under the Article 10, guarantees equality before the law and prohibits discrimination of any kind. Despite these achievements, the reality on the ground, especially in rural women in Kavango East region, shows that women and men still face a heavy challenge that limit their opportunity and dignity. Honorable Chairperson, honorable members, we are so proud to announce that Namibia celebrated for appointing women to higher leadership positions. And Kavango East offers an excellent example. The Minister of Gender Equality is a woman. The Deputy Speaker, of course, Honorable Vice Chairperson Kauma, is a woman. The Chief Regional Officer is a woman. The Regional Director of Health is a woman. The Regional Director of Education is a woman. And even the Queen of Sambi Traditional Authority are all women. This achievement deserves recognition. But, honorable member, there remain exceptions. In the villages of Kavango East, women remain underrepresented in local authorities, cooperatives, traditional councils, and business ownership. The Namibian Statistics Agency reveals 2023 and confirms that women form 51% of Namibia population. In Kavango East region, women are not only the backbone of families, but also the majority of the people. To include women is to include the majority. To include women is to include the nation itself. Empowering women directly reduce poverty, improve children's welfare, and grows the economy. This is not a theory. It is confirmed by the World Bank and UNESCO. For this reason, we must expand bursaries for rural women. As it was alluded on by the doctor, that our women should specialize in mental health care careers. And also to open finance and market through rural cooperatives. Women must be included in councils, in boards, and traditional leadership. As we are speaking, especially in our remote areas, when you look at the leadership traditionally, it is dominated by men. Most importantly, the rural women parliament with men as a partner must be institutionalized so that its voices influence really policy and programs. Colleagues, we are so glad that we were called for this session. As we are going back, we should not sit back, but we have to exercise what we are going to accumulate during this session. Honorable Chairperson, honorable members, as we debate gender equality, we cannot ignore the silent crisis of mental health. According to the World Health Organization 2022, it reveals Namibia has one of the highest suicide rates in Africa, with more than 600 cases recorded in 1 year, most of them men and boys. Men are 4 times more likely to commit suicide than women, as it was alluded on by the doctor. That we are so silent, that's why we are committing suicide. In Kavango East region, this crisis is worsened by poverty, weak health system, and daily hardship. Rural women suffer depression from the fear of losing babies on long, unsafe journey to hospitals, especially Andara, Nyangana Hospital, Sambi, and Rundu. Many miscarriage before reaching the care because of the poor condition of the road infrastructure. Men also suffer silently when unable to provide safe conditions for their families. Many internalize guilt, leading to depression or suicide. Honorable Chairperson, honorable members, the people of Kavango East region face severe structural challenges. Some inland villages rely on only one clinic. For example, in Diola constituency, we have only one clinic in the inland, that is Kanjara Clinic. Often without a permanent nurse or a doctor. That is the situation we are in finding ourselves at times. That if you go to that clinic, sometimes you might not find a nurse. Ambulances are too few, and where they exist, poor road means 30-kilometer journey can take more than 2 hours instead of 15 minutes. Colleagues, in Diona, we don't have a road where these people can speed up whenever they are called to attend to the agent's request. Poor mobile network coverage means family cannot call for help. Weak roads, poor telecommunication, and understaffed clinics are not small inconvenience. They are killing our people. Expectant mother miscarry on the way. Patients die before reaching the hospitals. Nurses avoid the rural posting because of the bad roads, poor network, and lack of housing. This cycle fuels depression and trauma and loss. Our recommendation, honorable members, we must act with agency. This House must resolve that all regional councils, starting with Kavango East region, should establish regional gender equality and mental health action plan, as it was alluded on by the doctor. With annual review, government must allocate dedicated budget for rural women, empowerment, roads upgraded, telecommunication expansion, and mental health services. We must improve roads so that ambulances reach every village with 1 hour. The Minister of Health should introduce a bush allowance to attract our nurses and doctors to rural areas. The Minister of ICT must expand network towers to ensure families can access emergency services. On mental health, we must strengthen counseling in schools and communities, expand the GBV one-stop center in rural hospitals, and launch suicide prevention program and peer support group for men and youth. Expectant mother must be supported through maternity waiting home near, especially our hospital like Andara, Nyangana, Sambio, and Rundu. The Minister of Home Affairs and Gender Equality must conduct regular mobile outreach to provide IDs, birth certificates, and register families for grants. Clinics should have social worker on site to link families directly to social assistance. Finally, our National Gender Equality and Mental Health Observatory should be established to track progress, report publicly, and hold ministry accountable. In conclusion, Honorable Chairperson, Honorable Members, the women of Kavango East cannot continue to suffer miscarriage on the road to hospital. The men of our community cannot continue dying in silence through suicide. Families cannot continue living without clinics, without roads, without ambulance, and without network. When women rise, family rise. When men get help, family heals. When clinics are built, ambulance arrive, and network connect. That is why we
from Taras region, Beersheba constituency, to share ideas to two crucial topics that are deeply interconnected: gender equality and mental health awareness. As human beings in God's creation, we always strive for a more inclusive and supportive society. Hence, the importance of to recognize the impact of gender disparities on mental health and well-being. Honorable Chairperson, honorable members, by promoting gender equality and addressing mental health challenges, we can create a more compassionate and equitable Namibia and the world for all. Allow me to say with you the following. The most challenge is the struggle for work-life balances. It continues to bear the brunt of household responsibilities. We are entitled to live in dignity, safety, and security. No stigma, no discrimination. Personal obligations can lead to exhaustion, chronic stress, feeling of never quite doing enough, whether at work or home. This is not just a logistical challenge, it carries emotional weight, often causing guilt, self-doubt, and a sense of inadequacy. Example, women in rural areas feel the pressure of everything to do for everyone. Example, a dedicated employee, present partner, supportive partner all at once, and it can cause a mental health leading to self-criticism when unrealistic expectations are not met. In conclusion, we need more awareness campaigns. We need to bring service closer to the people in rural areas. Honorable Chairperson, honorable members, I so submit to you.
Honorable Bengela, you are next.
I rise to make a contribution on the motion, gender equality and mental health awareness. But I'll base my point on gender equality. Gender equality means that individuals of all genders have equal rights, responsibilities, and opportunities. Honorable Chairperson, honorable members, Zambezi region, just like any other region in Namibia, faces challenges when it comes to gender equality. Although government has made strides towards gender representatives in both political and leadership positions, but we still face challenges when it comes to traditional authorities. Women are underrepresented in traditional leadership and decision-making forums, particularly in rural areas. Interventions. We propose that equal participation among males and females in decision-making must prevail. In conclusion, we need to continue with community sensitization to challenge these harmful gender norms and practices. So I submit. I thank you.
Honorable Thomas, the floor is yours.
Honorable Chairperson, honorable members, my name is Pete Thomas. I'm from Omaheke region, Kobabes. I rise to contribute to the motion Gender Equality and Mental Health Awareness. In Namibia, we face a troubling reality, and that is the high suicide rate among men, which reflects to the urgent need to challenge traditional gender stereotypes that discourage men and women from expressing vulnerability or seeking help. Honorable Chairperson, honorable members, promoting gender equality means creating a society where men feel safe to share their emotions and grow into healthy, confident men. Addressing mental health issues among men and women is not just about individual well-being, it is about fostering a more compassionate society for all. There is a critical link between gender equality and mental health, and therefore we need to work together to break down barriers and support our men and women and to build a future where everyone's mental health is valued equally. We do have a clinic in Dreamopsis. Those are closed for 2 years now. It's a rural area in Hobabes district. The doors are closed for 2 years now. If that clinic is operating, it will make things very easier for the communities that is staying in Dreamopsis. Instead of them taking hike to Hobabes, because going to Hobabes from Dreamopsis cost you $60 Namibian to go to Hobabes. So, in the middle of the month, if our elders doesn't have that $60, how are they going to meet the hospital, the clinic in Hobabes? And the challenge that we have in Hobabes with the clinic and hospital is, you go to the clinic, you already sit in a very long queue, and when you meet someone or a nurse to attend to you, you will be told that you need to see the doctor. But my experience is, I'm starting to think that we have only one doctor in Hobabes, because you will be told that no, you need to see the doctor. Come 2 o'clock, and then you'll be told that come tomorrow, the doctor is busy at the hospital. And then when we are referred to the hospital, it's the same up and down. No, the doctor is busy at the clinic, come tomorrow. So it takes you 3 to 4 days to see a doctor. Ministry of Health, please attend to this matter. and I so submit.
Thank you, Honorable. Honorable Kariko, the floor is yours.
Good morning, Honorable Chairperson, honorable members. My name is Otilie Kariko, coming from Otonjupa region in the Matako constituency. I want to add my contribution to the motion on table. And I'm starting with the following. Gender equality and mental health awareness are fundamentally linked as gender inequality creates significant linked. And the burden which is there, which is created by the two method of livelihood, particularly for women through discrimination, violence, and societal pressure to conform to gender roles. While women experience higher rates of certain mental health conditions like anxiety and depression, men face unique challenges such as increased suicide rate and pressure to suppress emotions. Fostering gender equality can lead to more supportive environmentals, improving mental well-being for everyone by allowing individuals to express themselves authentically and seek help without stigma. Honorable Chairperson, honorable members, how gender inequality impacts mental health for women. Women often face discrimination, workplace harassment, and gender-based violence, which are known to cause stress, anxiety, depression, and post-traumatic stress disorder. If I can take an example of what happened in Okanja constituency few months ago. Those happening in Okanja is like violence against children, but the people who was now mostly affected in that was the women. Those people of Okanja didn't sleep, the women was on the street to search for those kids. And they were traumatized like nothing. And they have to get the psychologists and everything. Therefore, we are in danger. As men as our partner, sometimes they harm us as women hardly. Societal expectation for men to be emotionally strong can lead to the suppression of emotions, increasing their risk of depression and other mental health issues. Men also have a high rate of death by suicide. Key areas of concern. How can such situations be assisted? We have to increase awareness, can foster more supportive environments where individuals can thrive and where mental health is prioritized alongside physical health. Number 2, mental health awareness initiatives focus on suicide prevention, reducing stigma, promoting health-seeking behavior, and providing psychosocial support. Gender equality in Namibia. In Namibia, there is a comprehensive legal framework promoting gender equality with over 88% of required legal framework in place under the Sustainable Development Goals. Well, therefore, in Namibia, there is such a legal framework which must be attended to. Mental health awareness in Namibia focus on suicide prevention. Organizations like Lifeline, Childline, Namibia conduct community awareness and dialogue awareness workshops, particularly targeting young men to reduce stigma and prevent suicide. The government must expand their service deep and far in the rural areas. As said by Dr. Jamba, they say they adopt a method what they have stolen from the other neighbor countries. We hope it will work for Namibia because most of the awareness here in Namibia is done in the towns mostly. And really the far people, they don't know nothing. And they don't even heard about a radio or a TV or whatever. And those people is the people who are always the attacked people. They are always attacked by that. So I hope that method, Doctor, it will come to Namibia in working move. Statistics-wise, women between the ages of 16 and 24 are almost 3 times as likely, 26%, to experience a common mental health issue in Namibia. As male of the same age, 9%. Are we together? Honorable Chairperson, honorable members, in conclusion, we must raise awareness about gender equality and mental health. My recommendation to the government must expand their assistance far in the rural areas. Educate the community to have effective and efficient skills to help others. Now, as I'm going back now to my councillor, I'm going to work hand in hand or shoulder in shoulder to see this Osho-Nshupa region, which is a vast region, how we are going to deal with sort of people who are not nearer to the, how can I say, to the community or nearer to the offices. How can we approach them to start helping them or to call for people who can assist us in that awareness? Thank you. I submit.
Thank you, Honorable. Honorable Roinasi, the floor is yours. Oh, you did not? Okay, then let me go to Honorable Naris.
Honorable Chairperson, honorable members, I rise to give the recommendation because so much has been said about women's violence. My name is Alexia Naris from the Guinea region. Before I give recommendations, I would like to out Dr. Njaba for the insightful presentation. And I'll add on what he says about child and lifeline indeed has a toll-free number. And the toll-free numbers, Honorable, please take note, is 116 and 106. So you can call those numbers anytime for counseling and you receive online counseling. Okay, here are my recommendations. In that region, mental health services include gender equality and develop programs, especially in the rural and underserved communities. When developing these programs, In many cases, young boys and men are left out. So also include involvement in this program, because if you want to see a change, then it's also from both sides. We have to include both men and women. Support economic empowerment initiative for women. Was at times when I am forced to choose between survival and safety. So once you empower the women, she'll be able to make a bold stand on her decision when she is pregnant. Find community-led healing spaces where people can speak freely, access support, and rebuild their lives. Challenge harmful cultures, gender norms that isolate men and silence women. Ensure that mental health care access, inclusivity, and culturally responsive. I've trained the community leaders, spiritual leaders, and community activists to champion gender-based violence and mental health in the community. This is a call maybe for a government to look into having a support victim friendly or victim support center at the police stations. Because this, in many times, because of the actions by the police, people are not they don't report the cases. Men are also abused, and when a man comes to report the case, they laugh at him. You are a man. So we need police to be trained, sensitized, and deal with, because these are very sensitive issues. And once they chase away people go and commit suicide. This is why so many suicides and killings are in our communities. So we need to take actions to reduce this in our community. People should join hands with civil society organizations, with the key stakeholders, all the government ministries, because you cannot just alone deal with this. So we need to unite and work together. There is a very good concept that is being used, which we tried in some of the communities. It's called LILO. LILO means looking in, looking out. So before you can help others, you have to do self-reflection. And it's a very powerful concept. And I think we conducted for that. It's called LILO Women and LILO Men. Actually, we are busy developing the LILO Men in it. It's a very powerful concept. The protection and safety of women. And this is based on the case that happens in Pimena Ocho, where somebody, a woman, was stabbed. The perpetrator followed her to the hospital and we killed her in the hospital. So how safe is our women? What can we do together to protect these women? I so submit.
Thank you, Honorable. Honorable Shufanyana, you are next. Shufanyana. Honorable, your Honorable, you can continue.
In our Wena region, we still see many challenges in gender equality. Girls often have a fever chance and the boys face silent struggles. Men, especially in rural areas, are suffering inside, and the number of suicides is increasing. Many men are told to hide their feelings or avoid asking for help. This program wants to raise awareness about mental health and create spaces for people to talk about these things. Let us treat women and men, girls and boys equal and give them both opportunities. The goal of gender equality and mental health awareness is building a fair society where both women and men are supported equal and mental health is taken serious so people can rise healthy lives. Let us support mental health for everyone, women, men, boys, and girls. Let us work together for a better, strong Namibia. I say so.
Thank you, Honorable. Now next is Honorable Uwule. Let me just announce the names so that you can know and prepare yourself, because we captured the name as you are raising your hands. So after Honorable Uwule, she will be followed by Honorable Cabos, and then after Honorable Cabos, we will have Honorable Clements, and then from Honorable Clements, the last on the list, but not the last to debate, is Honorable Kanyuku. Then we will still capture some more hints. You can proceed, Honorable.
Thank you, Honorable Chairperson. Honorable members, I am Tulik Ure from Unsati region, Sandy constituency. I rise to give my contribution on the topic gender equality and mental health awareness. For the silence voices in our rural community. In this 8th session of Rural Women Parliament with men as partners, especially where there are no clinic, no mental health program, and no support systems. Honorable Chairperson, honorable members, gender equality is a dream in many villages. Women and girls walk long distances for water, care for family without support, and they are often denied education and land rights. This is not just unfair, it is holding back our entire country. Let us remember, when a woman is empowered, a whole community rises. Honorable Chairperson, honorable members, there is another silent crisis, that is mental health. In rural Namibia, many people are suffering. They are suffering
from depression, stress, trauma, and anxiety, especially from poverty, unemployment, and gender-based violence. There are no clinics nearby, no counseling, and no mental health programs. People suffer in silence because they have no help and no hope. We cannot allow this to continue. We must bring mobile health teams to far remote areas, such as in our region, Onkanka, Amaupa, Oruhalu, Itatu, just to mention a few among other marginalized communities. Onesi Health Center, which caters for the population of 23,364, needs to be upgraded to a district hospital. We are also requesting a Unda clinic to become a health center. We must train the volunteers to provide basic mental health support. And we must start community education in churches, in schools, and through radio, so that people understand that mental health is real and help is possible. Let us not wait for big hospitals only before we act. Let us start where the people are, even under a tree, with the right information and support. Honorable Chairperson, honorable members, gender equality and mental health are not luxuries, they are rights. And rural Namibia deserves both. Let us bring healing, let us bring justice and gender equality in our all service delivery. I so submit.
Thank you, Honorable Ule. Honorable Kebas.
Thank you very much, Honorable Chairperson, Honorable members. I am Angeline Kebas from Harper Region. I rise to make a contribution on the motion of gender equality and mental health awareness. This important subject calls for intentions, inclusive and collective engagement of all paramount role players with the present trends of agendas aims at empowering women in the Namibian context. Its overpowering focus on women to extent that it simply impacts manhood ego of our male partners. At present, women are more and more dominantly featuring on all areas of society, ranging from positions of decision-making in public or private sectors. I so submit. Thank you.
Thank you, Honorable Kebas. Honorable Clements, the floor is yours.
Thank you, Honorable Chairperson, honorable members. I am Gina Clements from Commerce Region, Windhoek Rural Constituency. I rise on gender equality and mental health at this 8th session of the Rural Women Parliament with men as partners.
In Namibia, we often speak of gender equality, poverty, violence, unemployment, especially in our rural community. But now we must speak about mental health because these struggles affect not just bodies and homes, but our minds and hearts. Women and girls face gender-based violence, early marriages, just now recently in August of where we had um, about a case on a child marriage which involved a 14-year-old female minor in our very country, Namibia. Unequal access to land, education, and the emotional weight of unpaid caregiving. All of these contribute to depression, anxiety, and even suicidal thoughts. At the same time, our men and boys are under pressure. They have often been told be strong, to never show emotion, to provide even when jobs are few, and these expectations silence them. And many end up suffering in silence as a result into substance abuse, violence, or suicide as coping strategies. This is not a gender issue, it's a community issue. Honorable Chairperson, honorable members, gender inequality is not just about opportunity. It is also about emotional and psychological impact of being told your value depends on your gender. A rural girl who is denied education because she must marry early suffers not just economically but also emotionally. A rural man that told men do not cry may bottle up in stress, end up with trauma, and break up in silence and rush out in public. If we want to build healthy minds, we must first build equal community. Challenges such as mental health services, many clinics, including 3 that are in Windhoek Rural, have no trained staff on mental health. Stigma, people fear being judged when they seek help. Some believe mental health is a sign of weakness or even witchcraft. Cultural barriers, discussions around gender roles, depression, trauma, taboo in our communities. Honorable Chairperson, honorable members, it is our collective responsibility. Hence, the Rural Women Parliament with men as partners is a perfect platform to act as catalyst for change in our country. Possible actions. Community-based mental health support. Let us train our local nurses, our social workers, our community, even traditional leaders, on basic mental health, first aid, on trauma and informed care. Partners with relevant stakeholders to create safe space for people to speak out and to give them a chance to be heard. Engagement as allies. Encourage men to challenge harmful gender norms and speak openly about stress, fatherhood, and mental health. Promote positive masculinity through care, support, and emotional intelligence. Education and empowerment. Let us educate our citizens through various communication channels. Of course, for rural community,
we engage more through radio. Local events, traditional gathering to educate people about mental health and gender equality in their local languages especially. Budget allocation, let us make budget provision for mental health services to strengthen enforcement and gender equality at grassroots level. Honorable Chairperson, Honorable Member, all in all, mental health is not a luxury, it's a human right. We must build community where both women and men can live with dignity, peace, and mental well-being. Let it be a call to action. Together as women and men, let us rise for equality, for healing, and for a better Namibia. I so submit. Thank you.
Thank you, Honorable Clements. Honorable Kanuku, you are next.
Honorable Chairperson, Honorable Member, my name is Amen Kamuku, Oshana Region, representing Uvudia constituency. I stand here today as a rural woman, speaking for many families in our village who want a better future in this 8th Rural Women Parliament with men as partners. My contribution is very short for today. True development can't happen without justice. We must break the harmful norms, limit women's rights, and silence mental health struggles. Let us empower girls to go to school, women to own land, and men to support gender equality in homes and leadership. At the same time, we must speak openly about mental health. Stress, trauma, and depression are real. Let us build a culture where speaking help is seen as strength, not weakness. Honorable Chairperson, Honorable Member, in my conclusion, the future of our rural community lies in unity, equality, and action. Let us work together to build a society where every voice matters, every right is valued, and no one is left behind. I so submit. Thank you.
Thank you, Honorable Kanuku. Now is Honorable Huiras.
Yeah, Honorable Chairperson, Honorable Members. My name is Julia Marishan Wiras from Erongo region. I wanted to comment on the issue that is shaping the lives of our people, the gender equality and mental health awareness. They are not separate matters. They are threads of the same fabric through every home, every workplace, and every community. So easy to become a victim. In our country, With its high crime rate, it is nearly possible not to be a victim of your own loved ones. You don't choose to be a victim. You are made one by your loved ones. Worst of all is that you feel unsafe and not protected, left in fear, perhaps harbor feelings of revenge or suffer financial and emotionally. The bad thing about being a victim is telling your story to others. You sometimes get the impression that they wonder whether perhaps you are not apparently to be blamed. Why did you not share some before? Why did you not always protect the one that caused to harm you or let you suffer? Why have you done this or that? Mental health is a gendered issue. Honorable Chairperson, honorable members, we cannot speak of empowerment without healing. We cannot build equality without acknowledging trauma. To be a victim is traumatic. It turns your whole world upside down. You are totally confused. Sometimes you experience extreme emotion that you are unable to control yourself, or even you don't care about anything around you. And we cannot legislate dignity without addressing the mental health crisis that affect our people, especially those more downgraded. And for now, my brothers and sisters, I want to bring you forth a true story from the dusty streets of Usakos, Akaset. We remember the issue of loss of 6 people. I was the part and parcel of this community. I am the Lutheran pastor there, and this was my congregants. This boy was the beloved son, the grandson of this granny, and she loved from all the children. He was the chosen one, and he was undergo confirmation classes through me. He left the school, he left even the confirmation classes, just caused by the drugs. And this granny was so concerned about, and she often come to my office and said, Pastor, have mercy on my grandson and please confirm him. And I said, Mama, you are so concerned about this boy, but where is he? He's on the street. So if you bring him, we can maybe check what we can do. And it was time after time until this incident happened. And when this incident happened, I was at my outreach for the funeral. When I received the news, I finished the funeral, and when I arrived there at the home, the bodies was already removed, and I met the family there. And the family, I just show some condolence, and after all, I said we will check whether we will meet and so on. After the funeral and after all the arrangements, I come to the family place. And there was a woman, a family woman, who was asking for the same where the grandmother stopped, so that I can try to visit the boy in the prisons of Walvisveld. And I go and speak to the chief inspector of Usakos, and he admitted me to welfare by Narabel prisons. And when I come there, you always see that picture on the Facebook. It's me who confirmed the boy. And the family was waiting for me there, and the boy was just in the front, in the corridor. And when he see me coming, he was so surprised, and he said, "I know that you will come for me." And I confirmed him there just because of everyone deserves a second chance. If God says in His Word, in Luke 23, verse 34, "Forgive them, because they don't know what they are doing." What can we do if God says that? Can we give this boy a second chance that he deserves? I will tell you, my brothers and sisters, a true story. I had news from the boy, from the family members, which is in welfare spy. It's very good. It goes good with this boy. It sounds like he changed his life. By this, from the pastoral care, what can we do? By willing to listen when somebody tells his or her story. I know we can be very eager to hear other people's stories, but a Christian has to be able to listen. Listen, listen, and listen until they have taught you everything what happened, what they feel, and how it is still affecting their lives. Our church services, from the point of contact between our daily lives and meetings with God, perhaps we should ask ourselves whether our services are an escape from the cruel reality, or whether people receive hope for the reality by meeting God. From pastoral involvement with people who are victims, there are ample material for a pastor to address people need and distress. Honorable chairperson, honorable members, not everybody has a gift to serving people in trauma. People with necessary experience and skills can do wonders. Perhaps we report and offer ourselves willing to be trained. By helping a victim to become a victor, we build a society where equality is not just a measure, but in well-being we break the circle. This is what Christ wants us to do, to help and create a new beginning. I therefore call on this house today to integrate mental health services into all gender equality programs, especially those addressing gender-based violence, poverty and unemployment. Fund community-led healing initiatives that reflect our cultural strength, storytelling, art, pottery, and peer support. Train frontline workers, police, health staff, educators, and pastors. Challenges harmful gender norms that silence emotional, normalize abuse, and isolate survivors. Ensure that mental health care is accessible, affordable, and inclusive, especially in rural and underserved communities. Let us build a society where equality is not just a measure in numbers, but in well-being, where women are not just safe, but the whole, where men are not just strong, but support, and where every people, regardless of gender, can live with dignity, voice, and peace of mind. I so submit. Thank you.
Thank you, Honorable Kuiras. Honorable Hoho Beb, the floor is yours. I'm sorry to not to pronounce the name well.
Thank you, Honorable Chairperson, honorable members. I, Timotheus Hohobeb, from Sesfontein constituency in the Great Gunene region, rise to make a contribution on the motion, Gender Equality and Mental Health Awareness, at this 8th session of the Rural Women Parliament with men as partners. Gender equality has a complex but profoundly positive relationship with mental health. Gender inequalities create stressors like gender-based violence, GBV, socio-economic disparities, and harmful stereotypes, thus increasing risks for mental health conditions such as anxiety, depression, to mention but a few. Some individuals may even turn to drugs, alcohol, or other substances to, according to themselves, try and cope with the mental health consequences. Yes, our government and the Ministry of Education also needs to be complimented. They also try to bring in, as teachers we know, they brought in a subject called life skills. I myself was also a life skills teacher, but unfortunately, I was not trained as a life skills teacher to assist these children. That's the harder part. Yes, we will then call upon our Ministry of Education to see, at least to it, that it is included already in the curriculum, but then we try to see that we have qualified people to do life skills in schools to help our children at school level. Then, by so doing, at least, I think, we will reach most of the kids, if not all. Honorable Chairperson, honorable members, to improve mental health, societies must also put emphasis on the fact that there is no single right way to be a man or a woman. You must do this to be a man or do this to be regarded a woman. No. We are all equal. We should provide counseling and legal aid to support survivors of gender-based violence as well, and also raise public awareness where it is needed about mental health effects of gender inequality to reduce stigma. We must advocate for policies which support gender equality so as to alleviate stresses mentioned above and improve well-being among our communities. Thank you. I so submit.
Thank you, Honorable Hokobep. Now we move to Honorable Limbala, the floor is yours. Honorable Limbala.
Thank you so much, Honorable Chairperson and Honorable members. I'll be very brief. My contribution to this motion, mental health as well as gender equality, is drawn or based on my personal experience working with the community through the initiative that I mentioned earlier. Honorable members, Honorable Chairperson, Honorable members, as you'll be going back to our various communities, I must say that it will not be easy, especially if you're an advocate for something that you are also new in. We know that it's a growing concern, subject mental health, for our country as well as for our different regions. However, I would also like to state that perhaps government, in as much as there are people that are employed to do the work, there are people that are put in place to support especially the advocates or the people that will now become ambassadors for this community. There's also a need for support from other entities, support from the private sector in terms of resources that are needed to put together all these people and encourage them and educate them and raise awareness. I would also like to say that sometimes you might find yourself in positions where you are the ones now to take care of everything, from the logistics, as well as the whole part of the event. But as we go back, we must not be discouraged. Honorable Chairperson, honorable members, I believe that support is out there, and it's just for us to seek it and not wait for government to intervene.
Thank you, Honorable Limbala. Are there any further discussions? Honorable from this row, from the first, yeah.
Honorable Chairperson, honorable members. I am Monica Kaunyandirwa Chirembisa from the Great Kunene region. I rise to contribute on the motion of gender equality and mental health awareness at the 8th Rural Women Parliament with men as partners. A lot have been narrated already, but it feels unfair for me not to say something. I'll start contributing by saying gender equality mainly refers to the role of women and men, boys and girls, that they play in order to improve communication, coordination in their livelihood. However, I have observed in my region, with the inception of the gender, the concept of gender equality was perceived with assortment. In many instances, it also turned out to convince many people that women were captivating on the power of men. And also, on the other hand, women continue to disobey, affronting their male partners simply because they misunderstood the term gender equality. It is therefore imperative for gender activism to continue in the regions and filter down to the traditional rural setup
in order to ensure that the genuine meaning of gender equality concept is fully understood. Continuity must be our slogan. It is obvious that lack of proper information could lead to confusion and cultivate harmful relationships among families, co-workers, and even between boys and girls in their socialization patterns. In a genuine appeal, as a region, we are recommending that it must be mandatory to continue advocating for gender equality and to safeguard that their correct perceptions about gender is embraced by the majority of our citizens in the region and the country at large. The onus should be now on those who have been sensitized adequately but have opted to be ignorant by their own free will. Honorable Chairperson, honorable members, allow me now reflection on how mental health can contribute to social disturbances and lack of progress. Mental health is of a result of lack of understanding and accepting social issues, lack of self-control, lack of psychological support to deal with issues affecting an individual. Going through issues that are affecting your daily life may lead to mental health. Therefore, there is a need to strengthen family support, go back to mechanic society where neighbors, extended families, friends can give moral support to individuals and families to help them grow through social issues that may lead to extreme emotional disorders. Finally, Honorable Chairperson, honorable members, it is indeed imperative to fight together and to ensure that social issues that may lead to suicidal nature can be escaped as early as possible. Joining hands in promoting a spirit of caring and loving society is less costly than investing in a psychological treatment and death bills that could have been avoided. I so submit. Thank you.
Thank you, Honorable. I think we are now at lunchtime. You can see it is 1:08. So I don't want to cut off Comrade Mtenya, and I don't want also for you to leave some of the important points, but I'm just humbly requesting you please to be brief so that we can go for lunch, because after lunch we have got a very important topic that will be addressed, and we will come earlier. We have to be in the house at 2:15. That's why I am asking please to be brief and to the point.
Honorable Chairperson, honorable members, I'm Anna Hamtenya from Kapako constituency in Kavango West region. I rise to make my contribution on the motion, Gender Equality and Mental Health. It was a privilege to listen to Dr. Jamba for the presentation. It was so inspiring, empowering, and at the same time, healing. Honorable Chairperson, honorable members, mental health affects many families in one way or another. It is so traumatic to find yourself being a mother of a murderer, or find yourself being the mother of a person who fell victim to this gender-based violence killing, or someone who have died due to suicide. And the contribution to this are all mental health. So the awareness is there, but we still find cases of suicide among children, which shows that there's still a lot that needs to be done, because the services does not reach the rural people. Honorable Chairperson, honorable members, there's a need to speed up the program of bringing these services closer to the people, and mostly in the rural areas. As the doctor have alluded to, that these services supposed to be brought to the rural people. I suggest that it's better to identify people in the traditional authority, in communities, in churches, and at least someone at each clinic, a police station, or a sub-police station, in schools. Although we know that there are life skills teachers, but we still need to do more so that children at school have someone to talk to, so that these people can help while the mental health is still in its mild stage. So there's only one life skills teacher at the school, but if they can have at least a male and a female who are life skills teachers, that will do better. So far, sometimes people or children do not have someone comfortable to talk to. If these services are brought, if people are identified, children or people will have a choice to talk either to someone at the church, in the community, or at the traditional authority, or at school. They need to have a choice for whom they feel comfortable with. But if there's only one person, people might still distance themselves. So far, people run to the police station whenever there's a quarrel, whenever there's a fight. All they do is run to the police station. And sometimes the police officer who are found there is not trained to deal with mental health issues. I suggest that all institutions should integrate mental health program services in their plan of action. I so submit.
I see none. We are now going for lunch. We are now going for lunch, Honorables. Mind that in the next session, we will receive the Honorable Sankwasa, James Sankwasa, who will present us. So the time for us to be back in the house is 2:15. 2:15, all of us should be back in the house to receive the comrades. so that the honorable can find us insights. Thank you, honorables, for your contributions.